So we'll start. Next till vaya vibhajana we have seen. Next is Sara. Okay, so according to Charaka, 8 Saras are there. According to Kashyapa, 9 are there. Okay, so we'll see which are the Sara. So you can see Tvak, Rekta, Mamsa, Meda, Asti, Majja, Shukra, Sattva, Sara. These are the 8 Saras which is told by Charaka. Okay, additionally Kashyapa has mentioned Oja Sara. Okay, so these are the 9 Sara according to Kashyapa. So 8 Sara Lakshanas we can see. First one is Tvak Sara. Okay, so Tvak Sara Lakshana is Alpa Gambhirada, Loma Prabhava, Praharsha, Dirghayu, Ubhabhoga. So these are the symptoms, these are the lakshanas of the Tvaksara. Okay, Alpa Gambhirada, Loma Prabhava, Praharsha, Dirghayu, Ubhabhoga, like so much pleasurable things. Like they will be having Alpa Gambhirada means like a little bit stubbornness will be there. Loma Prabhava, they will be having hairs in all over the body. Praharsha, they always will be very happy. Dirghayu, they will be having good longevity. Okay, Ubhabhoga, they will be having all items whichever needed for our life, all the things will be getting. Okay, so these are the Tvaksara Purusha Lakshana. Alpa Gambhirada, Loma Prabhava, Praharsha, Dirghayu, Ubhabhoga. Then Rektasara Purusha Lakshana. If there is Rekta is predominant, then what are the Lakshanas you can see in the body? Klesha Asahishnutvam. Like they will be withstanding the whatever difficulties they can withstand. Okay. Ushna Asahishna. Like they cannot withstand. Okay. Asahishnutvam. Asahishnutvam means they cannot withstand the klesha. They cannot withstand the whatever difficulties they cannot withstand. Ushna Asahishnatam, they cannot withstand the hot. Okay, Ushnatva, they cannot withstand. Alpa Bala, they will be having less strength. Manasvitam, like they will be having good mind. Okay, so these are the Lakshanas of the Rektasara Purusha Lakshana. Mamsasara Purusha Lakshana, Alaulyam, like their body will be very flexible. Okay, it will be very flexible. Kshama, they will be having good withstanding capacity will be there. Arjavam, Dhridi, intelligence, all the things will be there in the Mamsasara Purusha Lakshana. Medasara Purusha Lakshana. If Medas is excessively, then Upajaratva, Pradhana, Ubhabhoga, Arjam. It is almost similar to Mamsasara. Okay, like much more stability will be there in their life. They will be having all kind of things whichever needed for their life. Then they will be very kind to the other people. Okay, so this type of Lakshanas you can see in Medasara Purusha Lakshana. Next one is Astisara. Okay, if Asti Dhatu is predominantly, if you are seen, then what are the Lakshanas you can see? Mahodsaha. Okay, Mahodsaha means they will be very energetic. Okay, Klesha Sahatam, they will be withstanding all kind of difficulties. Sara Sthira Shariram, their body will be very strength and very stable type of body will be there. Kriya Vanda, they will be very enthusiastic to do all kind of work. Okay, they will be doing all kind of work related things, so they will be very like energetic type of people. So that's that type of Lakshanas you can see in the Astisara Purusha Lakshana. Then Majjasara Purusha Lakshanas are Tanu Anga. Their body parts are very thin in structure. Snigdha Varna, there will be moistness will be there. Swara, Swara means like their voice will be very sweet. Okay, Apatya Sammana Shruta. So these are the Lakshanas of the Majjasara Purusha Lakshana. Then Shukrasara, Saumya Prekshina. Okay, so this Shukrasara Purusha Lakshana is very very important. Okay, so Saumya Prekshina, they will be having little bit Saumyata, like very soft in nature. Kshira Purna Lojana, their eyes will be very white in color. Okay, like milky type of colors will be there. Kshira Purna Lojana. Okay, then Apatya. Then Sattvasara Purusha Lakshana, Mahodsaha. So Mahodsaha you can see in Astisara Purusha Lakshana also, Sattvasara Purusha Lakshana also. So that is important, Mahodsaha. Okay, so they will be very enthusiastic, energetic. Then swasti gadi, they always will be feeling very peaceful mind. Okay, kalyana abhinivesha, like their life also will be very good in structure. So these are the lakshanas of the sara purusha lakshanas. Okay, so especially this shukra sara purusha lakshana is very very important. So these are the 8 saras which is told by Charaka. Okay, Tvak, Rekta, Mamsa, Meda, Asti, Majja, Shukra, Sattva. Additionally, Kashyapa has mentioned Ojasara. So the next one is Yogyam ki Shaktiyam. Like that one description they have mentioned, that is not important. Okay, you can just leave it. Next one is Swapna Bheda, types of Swapna. Okay, Charaka has mentioned 7 types of Swapna. Drishta, Shruta, Kalpida, Prarthida, Anubhuda, Bhavika, Doshaja. So these are the 7 types of Swapna. According to Kashyapa, 10 types are there. Then Bhuda Unmada. Bhuda Unmada means like a Graha Avesha. Some evil spirit will be enters in our body and it will be creating some problems in our mind. Okay, so that is called Bhuda Unmada. Like a Deva Graha will be entering, Rishi, Gandharva, okay, Yaksha, Rakshasa. So this type of Grahas will enters in our body and the patient will be exhibiting so many mental problems. So that is called Bhuda Unmada. So like that, Charaka has mentioned 8 types of Bhuda Unmada. Sushruta also mentioned 8 types. Okay, then Vagbhata, along with the Charaka and Sushruta, along whatever Sushruta and Charaka has mentioned. Okay, so the 8th one. Additionally, he has mentioned Kushmanda, Nishada, Vedala, Preda, Agirana. These are the additional 5 Bhuda Unmada which is told by Vagbhata. Okay, Charaka has mentioned 8 Bhuda Unmada. Sushruta also mentioned 8 Bhuda Unmada. So in that, whatever Charaka has mentioned, so in that, instead of Shaba Unmata, he has mentioned this Shaba Unmata, Brahma Rakshasa Unmata. Instead of that, he has mentioned Deva Shatru and Naga Graha. These are the 2 additional Bhuda Unmada which is told by Sushruta. Okay, Charaka has mentioned 8. So in that Charaka's version, Shaba Unmata, Brahma Rakshasa Unmata, like the 2 Bhuda Unmadas are there. Instead of these 2, Sushruta has mentioned Deva Shatru and Naga Graha. Okay, so along with this Charaka's version 8, additionally Vagbhata has mentioned 5 more Bhuda Unmada. Okay, so 13 Bhuda Unmada according to Vagbhata. Next one is Madana Phala Yoga. Okay, like for Madana Phala, how many formulations are there? According to Charaka, 133. According to Sushruta, 31. Okay, so this yoga, Madana Phala Yoga, Kudaja Yoga, okay, Ikshvagu, like that formulations they have mentioned, the numbers are mentioned, okay, in Charaka. So that we'll see. I'll share you the picture. So you can see, okay. So Vamana Dravya, totally 6 Vamana Dravyas are there. Okay, so this is very very important. 6 Vamana Dravyas are mentioned by Charaka. Which are the Vamana Dravyas? Madana Phala, Jeemoda, Ikshvagu, Kridavedana, Dhamargava, Kudaja. Okay, so each Vamana Dravya, from that how many yogas are there? Okay, from Madana Phala 133 yogas are mentioned. From Jeemoda 39 are there. Ikshvagu 45, Kridavedana 60, Dhamargava 60 and Kudaja 12. So total 355 Vamana yogas are mentioned. Okay, so these are very very important. Okay, each Vamana Dravya, how many numbers they can ask it, and total Vamaga yogas are 355. Okay, so that is very important. Then Virejana Dravyas are 9 in number. 9 Dravyas are there. Okay, which can use it for the Virejana. So the Dravyas are Shyama Trivrit, Chadurangula, Tilvaga, Mahavriksha. It is a synonym of Snuhi. Then Saptala, Shangini, both are different Dravyas. Dandi, Dravandi, both they are also different Dravyas. Okay, so Shyama Trivrit, from that Trivrit Yoga, 110 yogas are there. From Chadurangula, 12 yogas are mentioned. From Tilvaga, 16. Mahavriksha, 20. Saptala, Shangini together, 39. Dendi, Dravandi together, 48. So total 245 formulations are there for Virejana. Okay, so total Vamana Virejana formulations are total 600 will be coming. Okay, Vamana yogas are 355, Virejana yogas are 245. So total formulations are 600 in number. Okay, so these are the dravyas and how many yogas are mentioned. That is very, very important. Total number is also important. Next one is Antariksha Jala Bheda. Okay, Antariksha Jala has classifications are mentioned. So Charaka has mentioned 3 types of Antariksha Jala. Okay, it is not Dhara, it is Aindra. Okay, you can just note down. It is not Dhara, it is Aindra. Okay, Aindra, Kara, Hema. These are the 3 classification of Antariksha Jala according to Charaka. Okay, Aindra, Kara, Hema. Aindra is the Pradhana Antariksha Jala. Aindra is the Pradhana Antariksha Jala. According to Sushruta, 4 types of Antariksha Jala, that is Dhara, Kara, Taushara, Hema. Okay, so this is the classification of Antariksha Jala. Next one is Oshtaroga. Okay, so Oshtaroga comes under the Mukharoga. Okay, so in Mukha, different classifications are there. Mukharoga means oral cavity. So in the oral cavity, you can get disorders in the Oshta. Oshta means lips. Okay, lips. So you can get disorders in the lips. Danda Roga, then the Mula Roga, Talugada Roga, Kandagada Roga, these are all comes under the Mukha Roga. So for each part different disorders are there and their numbers are also there. Okay, I'll show you. Okay, so Oshta Roga according to Sushruta 8, according to Vagbhata 11 in number. Okay, I'll show you which are the disorders. Okay, so you can see. So number of Mukharoga, according to Sushruta 65 Mukharogas are there. According to Ashtanga Hridaya, total 75 Mukharoga. According to Bhava Prakasha Yoga Ratnagara 67. Okay, so this Mukharoga, it is classified like each part different disorders are there. So Oshtaroga according to Sushruta 8 in number, according to Ashtanga Hridaya 11. Then the Mula Roga. Okay, so that is according to Sushruta 15. According to Ashtanga Hridaya 13. Then the Roga according to Sushruta 8. According to Ashtanga Hridaya 10. Jihva Roga. Okay, in the tongue also you can get disorders. That is according to Sushruta 5. According to Ashtanga Hridaya 6. Talu Roga. Talu Roga means palate area. Okay, in palate you can get disorders. So according to Sushruta 9. According to Ashtanga Hridaya 8. Khanda Roga according to Sushruta 17, according to Ashtanga Hridaya 18. Sarvaja Roga, which means disorders which will affect full oral cavity. Okay, so that is according to Sushruta 3, according to Ashtanga Hridaya 8. Then additional one Roga, one place which is told by Ashtanga Hridaya is Ganda Roga. Very important. Okay, so Ganda Roga, it is mentioned by Ashtanga Hridaya. Only one disorder he has mentioned. Ganda means cheek area. Okay, in cheek also we can get disorder, so that is told by Ashtanga Hridaya. Okay, so according to Ashtanga Hridaya, in 8 places we are getting Mukharoga. Okay, Oshta, then the Mula, then the Jihva, Talu, Kanda, Sarvaja, Ganda. Okay, so like that 8 places are told by Ashtanga Hridaya. According to Sushruta 7 places, Oshta, then the Mula, then the Jihva, Talu, Kanda, Sarvaja. So Ganda Roga is mentioned by Ashtanga Hridaya, and how many Ganda Rogas are there? Only one. Okay, so Oshta Rogas are according to Sushruta 8, according to Ashtanga Hridaya 11. So which are the Oshta Rogas? Okay, so Vadaja Oshta Roga, Pittaja Oshtaroga, Sannipadaja Oshtaroga, Rektaja Oshtaroga, Mamsaja Oshtaroga, Medoja Oshtaroga, Abhikhadaja Oshtaroga. So these are the 8 Oshtaroga according to Sushruta. Vada, Pitta, Kapha, Sannipadaja, Rektaja, Mamsaja, Medoja, Abhikhadaja. Okay, so among this 8, additional 3 more condition which is told by Vagbhata, that is Khandoshta, Gendalaji, Jalarbudha. These are the additional 3 Oshtaroga which is mentioned by Vagbhata. Okay, so this is the Oshtaroga according to Sushruta, according to Vagbhata. Next one is Garbhini ko Yavagu dene ka Vidhan. So Garbhini, okay, like the pregnant lady, for pregnant lady we can give Yavagu. So which are the times you have to give Yavagu? According to Charaga, 8th month onwards. Okay, like 8th month, 8th month we can give Yavagu. Sushruta has mentioned 6th month. On 6th month we can give Yavagu Pana. Okay, then they have mentioned this Panchakarma. Usually in the Garbhini, Panchakarmas are contraindicated. Right, in Garbhini, for the pregnant ladies, we don't do Panchakarma. Only one Panchakarma we will be doing, that is Basti. Okay, so Basti, in which timing you have to do it, very very important. Okay, according to Sushruta, the Basti is indicated in 8th month. Okay, Asthabana Anuvasana Basti. Okay, both are indicated in 8th month. Okay, so Asthabana Basti should be given with that you can just note down. Badarodagena, Badarodagena, Badara, Badara, Badarodagena, Payo Madhura Kashaya Siddha Asthabana, Payo Madhura Kashaya Siddha, Badarodagena, Payo Madhura Kashaya Siddha. With that you will be giving Asthabana Basti in 8th month. Then Anuvasana Basti with Taila. Okay, Anuvasana Basti should be given with Taila. Okay, so Sushruta has mentioned Basti we can give in Garbhini, that should be given in the 8th month. Asthabana, Anuvasana Basti both are indicated. Okay, so Anuvasana Basti should be given with the Taila. Okay, then Charaga has mentioned only Anuvasana Basti. Okay, Charaga has mentioned only Anuvasana Basti, that should be given in the 9th month. Okay, so he has mentioned we can give Basti, that is only Anuvasana Basti, and when you have to give 9th month, and by using Madhur Aushadha Siddha Taila. Madhur Aushadha Siddha Taila, with that you have to give Anuvasana Basti in the 9th month. Okay, next you can note down Kashyapa Acharya. He has also mentioned about Basti, but he is telling that Basti should be given in 5th month. Okay, Kashyapa has mentioned both Asthabana, Anuvasana Basti should be given in the 5th month. Okay, so that is important. Only he has mentioned on 5th month we are giving Basti. Okay, next according to Vagbhata. According to Vagbhata, 8th month Asthabana, Anuvasana Basti has mentioned. Okay, in 8th month we can give Asthabana Basti, Anuvasana Basti. Okay, Asthabana Basti should be given with Shushka Moolaga Kashaya. Shushka Moolaga Kashaya, with that Asthabana Basti is indicated. Okay, Anuvasana Basti very very important. He has mentioned Anuvasana Basti with Madhur Aushadha Siddha Grida. Okay, he has mentioned Anuvasana Basti with Grida, that is important. Rest of the Acharyas are mentioned Anuvasana Basti with Taila. He only Vagbhata has mentioned with Grida we have to give Anuvasana Basti. So Madhur Aushadha Siddha Grida, Anuvasana Basti, it is told by Vagbhata. So in 8th month Asthabana, Anuvasana Basti both are indicated. Then in the 9th month only Anuvasana Basti. Okay, so Vagbhata is telling Basti we can give in 8th month and 9th month. In both the months you can give Basti. In 8th month Asthabana, Anuvasana Basti, and Anuvasana Basti should be given with Grida. Okay, in 9th month only Anuvasana Basti, Madhur Aushadha Siddha Grida. Okay, so that is very very important. Charaga, Sushruta both are telling we can give Anuvasana Basti, that should be given with the Taila. But according to Vagbhata, with the Grida we are giving Anuvasana Basti. Okay, Charaga is telling in the 9th month only Anuvasana. Sushruta has mentioned in the 8th month Asthabana, Anuvasana. Vagbhata is telling 8th month Asthabana, Anuvasana, then in the 9th month only Anuvasana. Kashyapa is telling on 5th month Asthabana, Anuvasana Basti. Okay, so these are the Bastis which is related with the Garbhini time we are giving. Okay, this is important. So Grida Basti is told by Vagbhata. Taila Bastis are told by Charaga and Sushruta. That is very very important, related with the Anuvasana. Okay, next one is Prasudagara means स्त्रियों की संख्या. Prasudagara, like during the delivery time, there will be parijaragas will be there, female assistants will be there, no? So how many female assistants are required? According to Sushruta, 4 females are, he has mentioned 4 females it is required. But Charaka is telling many, like that fixed number is not there. Okay, so that is told, Sushruta has mentioned 4 females are required during the delivery time. So that as a parijaraga, so that is important. From that area you can get question. Okay, so Sushruta has mentioned 4 females which is required for the assistance of the delivery. Okay, next one is Visha Varnana, where you are getting the references regarding the Visha. Okay, so Charaka has mentioned in Chigilsa Sthana 23rd chapter you will be getting the details regarding the Visha. But Sushruta, he has separately he has given one Sthana for Visha, that is Kalpasthana. In Kalpasthana full chapters are dealing with only Visha. In Bhava Pragasha, in Chigilsa Sthana, you will be getting the details regarding Visha. And Kashyapa in Sarva Visha Pradipadaka Adhyaya. In that chapter, you will be getting the details regarding Visha. Okay. Next one is Upavisha Sankhya. Okay. You can just note down. Rasarakna Samuchaya, Bhava Pragasha, Yoga Raknagara. These 3 acharyas are telling 7 Upavisha. Okay, Rasarakna Samuchaya, Bhava Pragasha, Yoga Raknagara. These 3 acharyas are telling 7 Upavisha. Rasa Tarangini is telling 11 Upavisha. Rasa Tarangini 11 Upavisha. Rasarnava 5 Upavisha. Rasarnava, he has mentioned 5 Upavisha. Okay, each acharyas are different Upavishas are mentioning, that is not much needed. So just understand the number. Rasarakna Samuchaya, Bhava Pragasha, Yoga Raknagara 7 they are telling. Rasa Tarangini 11 Upavishas are there. Rasarnava is mentioned 5 Upavishas are there. Next one is Swara Bheda. Okay, so according to Charaka 6 Swara Bheda he has mentioned. Vada Pitta Kapha Rekta Medoja. According to Sushruta 6 Vada Pitta Kapha Sannipadaja Kshayaja Medoja. Okay, both are telling 6. Charaka is also telling 6. Sushruta is also telling 6. Only the last 2 are different. Rektaja Medoja Swara Bheda is told by Charaka. Kshayaja Medoja is told by Sushruta. Then Arojaga, or otherwise known as Bhakta Upaghada. According to Charaka 5 types. Vada Pitta Kapha Sannipadaja Manasika. Okay, these are the 5 types of Arojaga. Next one is Dauhrudavastha. Like when the lady become pregnant, they will be started to get feelings, no, like they wanted to have something. So that is called Dauhrudavastha. They will be getting that a baby also getting the heart, and that too like when like by 3 months or 4 months onward they will be started to getting some feelings. So that is called Dauhrudavastha. Each Acharya is telling that feelings are coming in different months. Okay, Charaka is telling from the 3rd month onwards Dauhrudavastha will be starting. Okay, so that is also an important one. Each Acharya they will be asking. Okay, so that Dauhrudha, that feelings when it will be starting, according to Charaka 3rd month. Okay, according to Sushruta 4th month. Okay, according to Vagphata 3 Paksha se 5 5 maas tak. Okay, 3 Paksha means like this one Paksha is 15 days. So 3 Paksha means around 45 days. 45 days means like a 1.5 or 2 months. Okay, so 2 months onwards till 5 months the pregnant lady will be feeling Dauhrudavastha. So in the MCQ if they are giving option 2 months, you should choose the 2 month. Okay, 2 month is the Dauhrudavastha according to Vagphata. According to Charaka 3, according to Sushruta 4th months. According to Kashyapa also 3 months. On 3rd month onwards we will be started to getting Dauhrudavastha according to Kashyapa, according to Charaka. According to Sushruta it is 4th month. According to Vagphata 2 months. Okay, 2 to 5 months. That is the duration of Dauhrudavastha according to Vagphata. So the next one is Garbhanali Chedana, like umbilical cord cutting. Okay, umbilical cord cutting, like after the delivery we will be cutting the umbilical cord, no? So that for that, which instrument we have to use? Ardhadara. Okay, Ardhadara Shastra we are used for cutting the umbilical cord. For that, where you have to cut it, the distance they have mentioned. Okay, according to Charaga and Sushruta, both are telling 8 angula distance we have to cut the umbilical cord. Okay, according to Vagbhata, 4 angula, very important. Okay, only Vagbhata has mentioned in 4 angula distance we have to cut the umbilical cord. Rest of the Acharyas are telling 8 angula. Okay, then after cutting the umbilical cord, we have to like there will be bleeding will be there, no? So to bleeding will be there, or maybe some infection will be happening. Okay, so to avoid all those things, we can do sejana with the kushta taila, that you can just note down. Okay, after cutting the umbilical cord, you can do sejana karma with the kushta taila. This is mentioned by Ashtanga Hridaya. Okay, sejana. According to Charaka, he has mentioned Lodradi Taila. Okay, with that we can do Sejana Karma after cutting the umbilical cord. Okay, Ashtanga Hridaya is mentioned, with the Kushta Taila we can do Sejana Karma. According to Charaka, Lodradi Taila has mentioned. Then if you are not doing properly this umbilical cord cutting, you will be getting disorders. Okay, so according to Charaga, 4 disorders we can get. Okay, due to the improper cutting of umbilical cord, we can get 4 disorders according to Charaga, that is Uttundiga, Pindaliga, Vinamiga, Vijrambhiga. Okay, according to Vagbhata, 2 conditions will be happening, Vinamiga and Vijrambhiga. Okay, due to the improper cutting of umbilical cord, according to Charaga, 4 disorders can get for the baby. Uttundiga, Pindaliga, Vinamiga, Vijrambhiga. According to Vagbhata, 2, Vinamiga and Vijrambhiga. Okay, next one is Annaprashana Kala. After the delivery of the baby, still when we will be started to introducing the solid food. Okay, according to Vagbhata, Shashtama Masa, which means 6th month onwards we can introduce the solid food. Okay, according to Vagbhata. But according to Kashyapa, is 10th month onwards we have to give the solid food. That is important. Okay, because Kashyapa is telling 6th month onwards we can start fruit juices. Okay, because till 6 months it was exclusively breastfeeding. Okay, so when you started to giving solid food, what happened? There will be dysfunction of the acne will be there. So that's why acne mandya, all the things can get it for the baby. So that's why first of all start with the fruit juices, and then slowly the acne will become improved, and by 10th month onwards we can started to give the proper solid food. Okay, so that's why Kashyapa is telling Annaprashana Kala, that is starting from the 10th month. But according to other Acharyas, Vagbhata, they are all telling from 6th month onwards we can start the Annaprashana Kala. Okay, so like that difference are there. Okay, Kashyapa is telling 10th month, rest of all Acharyas are telling from 6th month onwards we can start the Annaprashana. Next one is Karna Vyadhana Kala, when we have to do the ear piercing. Okay, so Sushruta is telling 6th and 7th month onwards we can start the Karna Vyadhana. According to Vagbhata, 6th, 7th, 8th month onwards we can start the Karna Vyadhana. Okay, during the Shishiragama, like when the winter season is happening, so that time we can start this Karna Vyadhana procedure, we can start like that he has mentioned. Okay, so Sushruta 6, 7, Vagbhata 6, 7, 8. Then if you are not doing properly Karna Vyadhana, okay, then you can get some disorders. Okay, that you can just note down. Okay, so in if you are not doing properly Karna Vyadhana, it can affect the Marma. It will affect the Marma. So if it is affecting the Kaliga, okay, if you are due to the improper piercing, if it is affecting the Kaliga Marma, according to Ashtanga Hridaya, what are the disorders will be getting? Raga, Ruk, Jwara will be there. Okay, according to Sushruta, Jwara, Daha, Shvayadu, Vedana, these are all happening. Okay, due to the improper karna vedana, if it is damaging the kalika pradesha, in kalika marma, in that area if it is getting hitting, then what are the conditions will be generated? According to Sushruta, jwara, daha, shvayatu, vedana. There will be fever will be there, burning sensation, swelling will be there, and severe pain will be getting. Okay, according to Ashtanga, the same only. Instead of swelling, he has not mentioned. Raga, Ruk, Jwara. Raga means redness. So, redness will be there, pain will be there, fever will be getting for the baby. If it is affecting the marmari, then what are the symptoms you will be getting? According to Ashtanga Hridaya, Shofa, Daha, Samrambha. Okay, so there will be swelling will be there, burning sensation will be there, like Samrambha, like restlessness will be there. Okay. According to Sushruta, Vedana, Jwara, Grandhi, there will be a small Grandhi will be forming, like tumor, like small growth will be there. So that is important. Grandhi is generating in the, when it is Karna Vedana happening in the Marmara Pradesha, Marmari. Okay, Vedana, Jwara, Grandhi. Then Rekta or Lohidika. So in that area, if it is creating damage, then Ashtanga Hridaya is telling Manya Stamba Apatanaga will be happening. Okay, like Vada Vyadis are getting. According to Sushruta, same thing. Manya Stamba Apatanaga Shirograha Karna Shula. These are the conditions will be developing. So this is also very, very important. Okay, so if you are doing improper Karna Veda in different places, these are the complications you will be getting. Okay, especially you have to give importance in the Lohidika Marma. In Lohidika Marma, if it is getting damaging, it is creating Vada Vyadis, Manya Stamba, Apadanaga, Shirograha, Karna Shula. In Marmari Pradesh, if it is affecting, you are getting Grandhi. Okay, then in Karna Vedana, if it is if the baby is having very thin Karnapali, okay, very thin Karnapali, then you can use Suji as the instrument. Okay, Tanu Pali. If the baby is having very thin earlobe, then you can use Suji as the instrument for Karna Vedana. Okay, if it is Bahala Pali, Bahala Pali means very thick earlobe is having, then you have to use Ara Shastra. Ara Shastra. This is the instrument you have to use for the thick earlobe for Karna Vedana. Okay, for umbilical cord cutting, we are using Ardhadara Shastra. For Karna Vedana, if it is a thin earlobe, Suji has to be taken. If it is a thick earlobe, Ara Shastra has to be taken. And after the Karna Vedana, you have to do Amataila Sejana. Amataila Sejana. Okay, so these are the important points related with the Karna Vedana. Next one is Dandolbheda Kala. Okay, when the teeth eruption is happening. According to Kashyapa, 4 to 8 months. Between that, teeth eruption will be happening. According to Vakphata, 8 months. Okay, during the 8th month, we will be getting the dental eruption. Okay, so different type of teeth is also there. Okay, I will just show you. So Dandolbheda. So total number of teeth are 32. Okay, total number of teeth are 32. These 32 teeth are divided into two types, Sakrajada and Dvija. Okay, Sakrajada and Dvija. Sakrajada 8 are there, Dvija are 24 in number is there. So total 32. Okay, Sakrajada 8, Dvija 24. Okay. So the name of the teeth you can see here. Okay, this is they have asked in the exam their correlation. Okay, Rajadanda we can correlate with the central incisor. Okay. Then Bastadanda we can correlate with the lateral incisor. Then Demstra we can correlate with the canine. Then Hanavya we can correlate with the molar and premolar. Okay, so like that 4 types of teeth are there. Okay, then Dandolpatti reason, like why this teeth is eruption. Teeth eruption is why it is happening. For that, Kashyapa is telling due to the Rekta we are getting the Dandolpatti. Okay, Dandolpatti Hedu, that you can note down. Okay, total number of teeth is 32 in number. It is classified into 2 types, Sakrajada and Dvija. Okay, then name of the danda they have mentioned Rajadanda, Bastadanda, Damshta, Hanavya. Okay, Dandulpatti Hedu. Why you are getting teeth eruption? So according to Kashyapa, it is Rekta is the reason. According to Ashtanga Sangraha, Asti and Majja Dhatu is the reason for getting Dandolpatti. Okay, so during the 8th month, if you are getting a dental eruption, like teeth is eruption is happening on 8th month, which means the baby will be getting Dirghayu. Okay, if the baby is getting teeth eruption during the 8th month, that is indicating the baby will be having good Ayu, Dirghayu will be there. Okay, if during the 4th month, if the teeth eruption is happening, that is indicating Madhyama Ayu or Hina Ayu. Okay, during the 4th month, if the babies are started to getting dental eruption, that is indicating Madhyama Ayu or Hina Ayu. Okay, Dandolpatti Bheda. Okay, 4 types of Dandolpattis are there. Samudga, Samvrada, Vivrada, Danda Sambat. Okay, Samudga, Samvrada, Vivrada, Danda Sambat. These are the 4 types of Dandolpatti we can see. Okay, Samudga, it is a, you can just note down, Shayi Nitya Sampadat. Shayi Nitya Sampadat. Shayi Nitya Sampadat means very early and easy decaying. Very weak teeth is called as Samudga. Early and easy decaying. That type of teeth is called as Samudga. Samvrada. Samvrada Lakshana is Adanyam Malishtam. Adanyam Malishtam, which means it is inauspicious. It is always dirty. That is called Samvrada. Inauspicious and always dirty. That is Samvrada. Vivrada, Anitya and Lala Ubahada. Anitya, it is also inauspicious, it is not good. Lala Ubahada, always there will be excessive salivation will be there. Vivrada. So Vivrada Danda means it is Anitya, it is inauspicious. Lala Ubahada, it is always there will be excessive salivation will be happening. Okay, and this Vivrada Danda, it is not fully covered with the lips. Okay, it is not fully covered with the lips. You can't close the lips properly because of this danda. Some will be having very upper teeth, like their teeth always will be protruding outside. Okay, that is called Vivrada danda. So you can't close the mouth properly. Okay, so that type of danda is called as Vivrada. It is not fully covered with the lips. That type of danda is called as Vivrada. Then Danda Sambat. Danda Sambat means like proper qualities of the teeth will be there. So all that proper qualities of the teeth is there. That is called Danda Sambat, like proper teeth. Okay, so 4 type of danda we can see: Samudga, Samvrada, Vivrada, Danda Sambat. Samudga means always very easily decaying, very weak type of teeth is called as Samudga. Samvrada always will be dirty. Okay, it is inauspicious. That is called Samvrada. Vivrada means it is Anitya and always they will be producing excessive salivation, and it is because of this Vivrada the lips are not fully we can close it properly. Then the Sambat means proper teeth. Okay, the full qualities of the teeth will be there. So that is total number 10 are there. Okay, then the Sambat means 10 proper qualities it is there. Then we can call it as a proper teeth. Okay, then the Sambat is 10 qualities are there. So then the Sambat number is 10. Then Dantodbheda Janya Roga. When the teeth eruption is happening, babies used to get some disorders. Which are the condition? Jwara, Vidbheda. Vidbheda means Adisara, diarrhea. Then Kasa, Chardi, Shiroruja, Adispandana, Potaki, Visarpa. So Potaki you have to note down because Potaki is a eye disorder. Okay, so that one you have to note down. So rest of the things are GIT related conditions you are getting. So these are the Dantodbheda Janya Roga. In case if Dantodbheda Janya Roga is happening, what is the treatment? Which formulation they have mentioned? Samangadi Grida has mentioned for the Dantodbheda Janya Roga. Then Aushadas to improve the Dandolpati for getting the good teeth eruption. Which are the medicines we can give? Vajadi Grida and Lavaga Mamsa Churnas are recommended for the if you rub this Vajadi Grida, all the things, if you keep it in the mouth area, you will be getting the proper good teeth will be arising. Okay, so these are the main things related with the Dantolbheda. Next one is Vamana Virejana Vyabhat. Okay, Vamana Virejana Vyabhat total according to Charaga 10 in number, according to Sushruta 15 and according to Vagbhata 12 are there. Okay, Vamana Vyabhat is also 10 in number, Virejana Vyabhat is also 10 in number. So which are the 10 Vyabhat? Atmana, Parikartika, Parishrava, Gatragraham, Hrudgraha, Jivadana, Vibramsha, Stamba, Kshaya, Urdhvagamana. So these are the 10 Vamana, Virejana, Vyabhat which is told by Charaka. 15 is told by Sushruta. Okay, Sushruta's version is not important, just number you have to study. Okay, so these are the Vamana, Virejana, Vyabhat. If you are not doing properly Vamana Karma, Virejana Karma, these type of conditions can happen in your body. Next one is Basti Netra Pramana. So very important. Okay, according to the age, how much length for the Basti Netra, how much dosage you have to give. These are all very important. According to Charaga, we'll see first of all. Okay, Charaga is telling 6 years. Okay, 6 years. If the child is having 6 years, then Basti Netra length should be 6 angula. Okay, 6 years, 6 angula. And the hole, okay, the Basti Netra, they will be having a hole, no? So the hole size should be Mudga Pramana. Okay, Mudga Pramana Chidra. Okay, so Basti Netra length should be 6 angula and the hole should be having Mudga Pramana. Okay, then if it is a 12-year-old child, then Basti Netra length is 8 angula and the whole size should be Satina or Matar. Okay, which means Kalaya. Okay, Satina or otherwise known as Kalaya. So Kalaya Pramana Chidra. Okay, Satina or otherwise known as Kalaya. Kalaya Pramana Chidra. Then if it is a 20-year-old people, okay, for them Basti Netra Pramana is 12 angula and the whole size should be Karkandu Pramana. Okay, Mudga, Kalaya, Karkandu. Okay, and the Netra Pramana is 6, 8, 12. Okay, so this is according to Charaka. Okay, when according to Sushruta, he has mentioned different things. Okay, this is very important. Most of the time they used to ask. Okay, so if it is a 1-year-old child, Basti Netra Pramana is 6 angula. Okay, and the whole size should be Kanishtiga Pramana. Sorry, this Agra. Okay, Kanishtiga Pramana Agra. Okay, thickness of the Basti Netra should be Kanishtika Pramana. Chidra Pramana is Mudga Pramana. Okay, the whole size should be Mudga Pramana. And how much dosage you have to give for a 1-year-old child? That is 2 prasrida. Okay, Matra of Basti. Okay, that is 2 prasrida. Matra of this Niruha Basti, that is 2 prasrida. Then 8-year-old child, 8 angula pramana length should be there. Okay, and this Anamiga Pramana Agra should be there. Okay, Anamiga Pramana Agra. Then Chidra should be Udad Tulya. Udad means Urad Dal. Okay, that is Masha Pramana Chidra. Masha Pramana Chidra. And how much dosage for the 8-year-old child? That is 4 prasrita. Okay. Then 16-year-old child 10 angula. Okay, for 16-year-old 10 angula pramana, and the thickness should be madhyama. Okay, madhyama anguli pramana agra. Madhyama anguli pramana agra. Then the chidra should be matar tulya. Matar means kalaya. Okay, so kalaya pramana chidra. Madhyama anguli agra, kalaya pramana chidra, and the dosage is 8 prasrita. Then 25-year-old, for them it is 12 angula. Then the thickness should be angushtodara, and the chidra pramana is kolasti tulya. And for the 25 to 70-year-old people, the dosage is 12 prasrita. Okay, 25 to 70-year-old people, Niruha Basti Pramana is 12 prasrita. This much quantity should be given. After 70-year-old people, okay, more than 70-year-old people, for them measurements are same, but the dosage is 8 prasrita. Okay, so matra is different in the old age people. After 70-year-old people is coming for the basti, then 8 prasrita is the quantity. But the size is same as that 12 angula pramana, angushtodara, agra, kolasti tulya, chidra. Okay, these are the measurements, but the quantity is 8 prasrita. So these are the matra of Niruha Basti according to Sushruta. Then Vrana Netra Pramana. Vrana Netra Pramana is 8 angula, and Mudga Tulya Chidra. Okay, Mudga Pramana Chidra is the Vrana Netra. Then according to Vagbhata. Okay, more than you will be getting question related with the Sushruta Acharya and Charaka Acharya. Okay, so that two things you have to note down. Okay, Vagbhata version is also you can study. But more commonly we used to get questions from the Sushruta and Charaka's version. According to Sushruta and according to Charaka they will be asking. So in according to Vagbhata, less than 1 year old, it should be 5 angula pramana should be there. Okay, Basti Netra Pramana is 5 angula, less than 1 year old child. 1 to 6 year old people 6 angula pramana. Okay, then 7 year old child 7 angula pramana. Okay, then 12 years. Okay, 7 to 12 that should be 8 angula pramana. 12 to 16 that is 9 angula pramana. Okay, 9 angula. Then 20 year onwards it will be 12 angula pramana. Okay, 20 year onwards 12 angula pramana is the length of the Basti Netra. Okay, next one is doshas they have mentioned. Okay, Basti Netra dosha according to Charaga 8, according to Sushruta 11. Basti Pudaga dosha according to Charaga 8, according to Sushruta 5. Basti Dada dosha according to Charaga 10, according to Sushruta 6. Then Basti dosha, that is according to Charaga 12. Then Sushruta has not mentioned Basti dosha. Okay, so total, according to Sushruta, total number of Basti dosha is 76 in number. Okay. Okay, so Basti Vyabhat according to Sushruta it is 76 in number. Vaidya Nimittaja, due to physician. Okay, due to physician you can get a disorder, like due to the action of the physician we can get Basti Vyabhat. That is total 53 has mentioned. Basically 44 will be there plus 9 Basti Vyabhat. Okay, like Vamana Virejana Vyabhat we have seen, no, like 10 Vamana Virejana Vyabhat according to Sushruta, 15 Vyabhat is there. That so Basti Vyabhat according to Sushruta it is 9. Okay, plus 44 disorders based on due to the action of the physician you are getting, like that total 53. Okay, Vaidya Nimittaja, due to the action of the physician if you are getting Vyabhat. Okay, due to Vaidya Nimittaja. Okay, due to the action of the physician if you are getting Vyabhat. Okay, that is total 53 in number. That 53 is divided into 2, 44 plus 9. Okay, the 9 which is told by that is only Basti Vyabhat, like that Ayoga, Adiyoga, that type of things are comes under the, that is 9 in number. Basti Vyabhat 9 plus 44 Vaidya Nimittaja Vyabhat. Okay, then Adura Nimittaja, due to the action of the patient. Okay, due to that you can get Basti Vyaba, that is total 15 in number. Then Vaidya Adura Nimittaja, both action of the physician and both the action of the patient. Okay, due to both of their action you can get 8 Basti Vyaba. So total 76. Okay, total 76 are there. Vaidya Nimittaja 53, Adura Nimittaja 15, Vaidya Adura Nimittaja 8. And like that total 76 Basti Vyabat are there. Okay, so Vaidya Nimitta Vyabat, that 44 I have mentioned. So that is how it is classified. Pranidhana Dosha 6, Basti Netra Dosha 11, Basti Dosha 5, Pidana Dosha 4, Dravya Dosha 11, Shayya Dosha 7, like the total 44 plus 9 Basti Vyabat, that is called as Vaidya Nimittaja Vyabat, 53 will be coming. Okay, so this is the classification. It is not much important, just Charaga, according to Charaga only they will be asking more commonly, we used to see. Okay, so just understand these are the 44 Vaidya Nimittaja Vyabat plus 9 Basti Vyabat, so togetherly 53 will be coming. Okay, so this is about the Basti Dosha according to Sushruta. Okay, so rest of the things, rest of the remaining portion we'll see on the next class.